Hi, my name is Morgan. I will be your nurse today. I am going to be performing a cardiovascular and pulmonary assessment on you. So to start out, how are you feeling?
Good.
Good. Okay, so to start the cardiac assessment, I'm going to look at your jugular veins, assessing for any kind of distension, any strong pulsations, which I don't see just visibly. Now I'm going to assess your carotid arteries. So, starting up high and kind of working my way down. And can you turn to your right? Okay, and now turn to your left. Okay, and you have a good pulse all the way down your carotid. Now I'm going to listen to it with my stethoscope, checking for any kind of heaves or thrills or lifts or any really abnormally strong pulsations. So I need you to turn to your left. Okay, now turn to your right. Okay, and I didn't hear any presence of bruits or thrills. Listening both with the bell and the diaphragm because it really gives me a good depiction of what your carotid's doing and listening to it to make sure that there isn't anything abnormal going on. So now I'm going to assess your cardiac function first, so if you could take off your shirt for me. Okay, first just by inspection, looking for any kind of ventricular pulsations, anything abnormal, which I don't see. Then I'm going to palpate, first starting with on the right side of your sternum and the second intercostal space. That was your aortic, now this is your pulmonic. And going to the third, fourth, and fifth intercostal, also known as Erb's point. And assessing your mitral valve as well, which I don't note any abnormalities there. Now I'm going to take a listen. Assessing again for any thrills, heaves, lifts, any kind of murmurs, or anything abnormal noted. Okay, heart sounds regular, has a good strong beat. I didn't hear any murmurs or anything abnormal or worrisome. I could hear S1 and S2 heart sounds, so that is normal as well. Now I'm going to proceed with my peripheral vascular assessment. First starting with the checking for aortic, abdominal pulsations, which I don't see any. Now I'm just going to take a listen and palpate, feeling for any kind of aortic pulsation. Going to the iliac and renal arteries, just palpating that pulse. And in a clinical setting, I would have him remove his pants and assess his femoral arteries as well, as far as palpating and listening. So now I'm going to listen. And I do hear a good pulse in that vascular area. So now I'm going to do the peripheral neurovascular. So I'm going to start by assessing his arms, checking for skin color, noting any kind of dryness, making sure that the color is consistent with the rest of his body, which it looks like it is. Now I'm going to check his capillary refill on each of his fingers, making sure it's less than 3 seconds, which it is. Okay, and then I'm going to assess his radial pulses. Brachial pulses as well. And he has good pulses there. And I believe that is it for my upper extremity assessment. So now, also I would note any kind of edema or any discoloration that I saw with it. I don't see any of that. So now I'm going to have him lay on the couch. Okay, and I am going to roll up his pant legs. So first, just looking at his extremities, making sure that they have good color, that they're warm. Assessing cap refill on his toes. Again, that would be less than 3 seconds, which is normal, and his are. Assessing for edema, kind of squeezing his legs, making sure that there's not non-pitting edema or anything of that sort, which doesn't look like there is. Then I'm going to assess his duralis pedis pulses. And those are good. And now I'm going to assess his popliteal pulses. Stretch your leg. And that's good. Okay. So pulses are good in the lower extremities. Now I'm going to use the Pullman sign to assess for DVTs. So what I'm going to do is pull his foot up toward him and squeeze his calf. And is there any pain noted with that?
No.
Okay. And how about this leg?
No.
Okay. So if there was pain associated with that, then we would do a further assessment for a deep vein thrombosis and see what's going on there, why he has pain, but since he does not, I think we're good to go. So you want to sit up. Yep. And go, get the chair. So that concludes our cardiac and neurovascular assessment. Now we're going to proceed with the pulmonary assessment, or the lungs. So first, just inspecting, making sure that his rate is regular, depth is regular, symmetric expansion, which it does look like that. I also want to note if there's any use of accessory muscles, whether that be abdominal or oblique muscles, which I don't see that either. Do you feel short of breath at all?
No.
Okay, perfect. And so first just inspection, everything looks good. So now I'm going to palpate, checking for any kind of subcutaneous air trapping, which it would feel kind of like Rice Krispies under his skin, but I don't feel that. So now I'm going to assess for tactile primitives. So I'm going to place my palm in the intercostal spaces and have him repeat 99 to me.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and there I am assessing to make sure that vibration is symmetrical on both sides, ensuring that it's present and symmetrical on both sides, meaning it's not really noticeable on one side or not as noticeable on the other. So now I'm going to auscultate his lung sounds. I'm going to start anteriorly on all of this and then move to posterior. So if you could just take a deep breath every time I close my stethoscope to you. Okay, if you could look to your left. Oh, and look to your right. Okay. And anterior breath sounds are clear bilaterally. I am not noting any kind of crackles, any wheezes. Was that difficult for you?
No.
No. Okay, perfect. So now I'm going to assess the posterior side of his lungs. Yeah. Okay, so first inspection always, making sure that he doesn't have any signs of difficulty breathing, any acute respiratory distress, which I don't see. So now I'm going to palpate, making sure I do not feel any subcutaneous air trapping, which I do not. Okay, and now I'm going to auscultate on the posterior side. Just take a deep breath every time every time my stethoscope is placed on you. And posterior breath sounds are clear bilaterally as well. Good breath sounds on both sides. Not noticing any wheezing or any kind of difficulty with that. So at this point, that concludes our cardiac and neurovascular and pulmonary assessment.